A message on behalf of the Canadian Federation of Nurses Unions. In January of 2023, the Ontario government announced that it will permit thousands of surgeries, like hip and knee replacements and cataract surgeries, to be outsourced to private for-profit providers, as well as diagnostic testing such as MRIs and endoscopies, resulting in 50% of surgeries being shifted out of the public healthcare sector. Patients may not always be required to pay for medically necessary procedures in a for-profit clinic, but they can be charged for upgraded products, administration fees, block fees to physicians, equipment necessary for treatment and blood testing, and the usage of these clinics over publicly owned and operated facilities can have troubling results for patients, workers, and the government. What is privatization? It is the citizens of Canada paying out of pocket or through private duplicate insurance for healthcare. It can also be public funds being used to pay for care delivered through for-profit, investor-owned facilities. While the Canada Health Act forbids the extra billing of patients, there is no explicit ban on private for-profit clinics. In British Columbia, private clinics, including surgical centers, were contracted to perform publicly funded procedures, thus engaging in unlawful billing. Ontario plans to outsource thousands of medical procedures to private clinics, which will result in many public healthcare nurses and doctors leaving their positions. This contributes negatively to an already critical nursing shortage and limited doctors, thus short-staffing public facilities that are already caring for vulnerable and complex patients admitted to public hospitals. These plans only benefit those who can pay the exorbitant fees to bypass wait lists, entitling them to healthcare access that may not be medically necessary. This causes patients who use the public sector to face longer wait times due to the resources being used, even if they require care more critically. The government also pays more money for these same services than in the public systems, to account for the profit margins for owners of these clinics and their shareholders. Some believe private healthcare facilities will lead to better health outcomes because they need to provide high-quality care, but the evidence isn't there. Profit motivation does not incentivize higher quality care, as these corporations are legally bound to deliver profit returns to shareholders, shifting the focus from patient care and trust to profits that can result in higher mortality rates. Private, for-profit healthcare clinics do not have the same public accountability and can be victim to poor oversight and lack of transparency. Confidentiality agreements between the provinces and these clinics keeps the amount paid by the government a secret, concealing the real medical costs. The Canadian Federation of Nurses Unions stands firm in the core beliefs that healthcare is not a commodity to be bought or sold. Federal health funding to provinces and territories should be directly spent on patient and resident care, without any funds going towards profit-making shareholders. Provinces and territories should refrain from outsourcing healthcare services to the private sector. Instead, should bring long-term and home care from within the public system. Lastly, oppose the use of private surgical clinics rather than expanding funding and capacity of public hospitals. The Canadian Federation of Nurses Unions believes that the private sector lacks transparency and accountability compared to the public sector. That privatization leads to the degradation of care through cutting costs to increase profits. Oppose the privatization of the Canadian healthcare system.